Hello, everyone. This is Dr. Barber at Rose Chiropractic. I decided to do another heart sound recorder. I hadn't done one of these in probably about a month or so. But we've been doing quite a bit of them here at the office. This one's a little special, and I want to kind of go over what you're looking at here. This is a patient. She's 59 years old. The first one you see is the resting heart rate. This one's actually after a 5 mile run, and literally like right after a 5 mile run. So she was still quite out of breath when she came into the office, and I wanted to actually see what the difference was for a patient who put that much pressure on her cardiovascular system, to see what the changes are. Now, if you look at the first one, you can see the heart's fluttering a bit. You see a little roughness. This is actually an indication as the blood is circulating through our arteries, it's actually making noise. So that's what that sound is, and you can actually see that all the way across. It's pretty rampant all the way across. All right. So what I gave her was a product called Saruda, and Saruda basically helps to smooth the blood flow out, and we always call it Roto-Rooter for the arteries because it actually does help to some degree to smooth that arterial flow, and that's actually what we're looking for. So she took 6 of them. On the second one, so this is after a 5 mile run. There's actually a couple of things I'm going to show you on this, but that's the first one I want to show you. But you can see how that's a little smoother. See how rough that is through here, rough through here. Heart flutters a bit. You can see how that's smoothing out. This is only an hour later, okay? Or an hour and a half, I guess, after she took the supplement. So that's a pretty big change in that short a time period. The second thing I noticed on her is if you see these points here, this is actually where the second heart sound should be. You can kind of see a little baby one there. Almost nothing there. This one is actually fine. That's an indication that she's not absorbing calcium, so the muscle tissue itself is not absorbing calcium. I'm not going to actually do anything with that this month, just because I want to see the difference when she comes back next month after, after she's been on this Saruda for a little while. The other thing, the other thing I want to go over, let's look at the other areas of the heart. So this is the tricuspid, and you can obviously see her heart rate is a lot faster on the second one than on the first one, because obviously she just ran 5 miles. But if you look at the strength of the beat itself, comparatively speaking, you can see how the second one isn't quite as strong as the first. You can see that here. Those are actually okay, but you see it starts to kind of fade again here and here. Even here, the thickness of it isn't quite as thick, so the heart's fading a bit. So that's an indication she doesn't have enough protein. There's not enough protein there to build the muscle tissue, and that's actually what that's showing. You can really see it on this one too. So, again, you can see how rough these are all the way across. You can see these are not quite as rough, if you look at that. But you can see the strength of it. Again, that's just an indication that there's not enough protein there for her heart. So what I asked her to do was just to increase her protein intake over the next month. So we're basically going to redo this study again then, and see what it looks like. See what changes occur. But I'm literally having a double her protein intake, so we're gonna see what happens. You can see it here again too. So you can see that under the stress, you can see the muscle tissue itself is a little bit weaker, and that's actually what that's showing. So the heart's tired, and the reason why it's tired is you're not getting enough protein in there. The body's just not absorbing enough, and it's not strong enough. So we want to make sure our heart's super, super strong. She's basically training for a marathon, I believe in April or May. So she's running 4 to 5 days a week. She does 5 miles and then 6 miles, between 5 and 6 miles a day. So today was one of her 5 mile days, and so we discussed it and decided to kind of run this just to see what the changes would be. So anyway, I wanted to show you guys the difference there. You can definitely see, particularly on the first view, that the arterial area is definitely smoother. I mean, it's still rough, but it's definitely smoother. So and that was from Saruda. We know she's not absorbing calcium. We know she needs some a little bit higher protein intake. I mean, this is, if you guys are working with any athletes, particularly the doctors out there, if you guys are working with athletes, you got to be doing this kind of stuff, because this could be the difference between, that little 1% you're trying to get out of somebody, to make sure they make it to the next level, especially the pros out there. These are really simple things to do and simple handlings, and you can obviously see the difference. So anyway, just wanted to let you guys see that and give you some more data on it. And always remember, a well-nourished body is a happy body.